All right, name that method of pain control for childbirth that's the most common, but likely also causes the most anxiety. Survey says, let's talk about it. Picture this, you're in labor, those contractions, they're really starting to pick up steam, and then you decide, yeah, I'm all good, I'm all done with this. So you grab your cowbell, you hammer down on it, you say, I want an epidural. So then what's gonna happen next? Well, this face is gonna come on in the room. My name is Tina, I'm a labor and delivery nurse. If this type of content interests you, go ahead and click subscribe so we can keep learning together. And then back on track, yes, the epidural. What's gonna happen next? Well, I'm gonna walk you through it step by step so you know exactly what to expect if you ask for one. All right, guys, first thing you need to know is that an epidural, it does have risks and it does have side effects because it's a medical procedure, right? And no medical procedure is without risks. But even though it's scary to talk about it, you need to understand those risks so you can give a really good informed consent. And here's a hint, the best time to talk about these risks and side effects, it is not when you are at a 10 out of 10 pain. So when you arrive to the hospital, that is going to be the best time to talk with the anesthesiologist and go over the risks and side effects so you can get a really good grasp on them before you make that final decision. Off the top, the first big possible side effect from an epidural is going to be a drop in your blood pressure. This drop in blood pressure would be caused by the medications that are going into the epidural to give you that pain control. And this drop in your blood pressure can actually cause a secondary side effect of a drop in baby's heart rate, because when your blood pressure goes down, so does the flow through the umbilical cord, which is going to bring baby's heart rate down. This is why after you get an epidural, we put on a blood pressure cuff and we put on baby heart rate monitors so we can watch your blood pressure and we can watch baby's heart rate. But I'm going to give you a hint here. You're going to know your blood pressure is low before my machine picks it up. So if you are feeling lightheaded or dizzy or nauseated, make sure you let your nurse know right away, because we can easily fix this low blood pressure with things like IV fluids or bringing the head of your bed down or giving you medications through the IV to bring it on back up and make you feel much, much better. Besides the low blood pressure, other common side effects can be itching. Some people report they just want to itch their skin right off, but rest assured, I have something I can give you for that as well. And then another common one is pain in your lower back, either feeling like you have kind of a bruise where the needle went in or a sore lower back for a couple of days after your epidural comes out. And then the last one is, sadly, some people have trouble peeing after. This is going to be caused either by those nerves that we're working on with the epidural or from the catheter itself, which is going to go in to help control your bladder when you can't get out of bed to go pee. And we'll talk more about the catheter later in the video. Of course, there are more severe side effects that are less common, but you do need to be aware of them. One is going to be a sudden severe onset of a headache. It gets much worse when you sit up. And this one's actually caused by leaking of fluid, and that fluid would have been accessed when they put the needle in to start the epidural. Another one is trouble breathing. Sometimes the epidural, it numbs higher than we anticipated, and it numbs these breathing muscles, so it makes it feel like you're not able to take these big deep breaths in, even though your oxygen levels, they are doing okay. And then the last one, this is the one that freaks the most people out, understandably, it's going to be nerve damage. But I do want to tell you that nerve damage is really rare. It affects anywhere in between 1 in 50,000 people to 1 in 200,000 people, but you do need to be aware that it is still, unfortunately, a possibility when you get an epidural. All right, you've made your decision, you want the epidural. There's a few things you and I have to do to get you ready before the anesthesiologist comes into the room. First thing I'm gonna do, if you don't already have one, I'm gonna put an IV in. And I know it sucks and it hurts, but it is necessary because we talked about that low blood pressure being the most common side effect of an epidural. Well, if I don't have an IV, I cannot give you medications and I cannot give you fluid to bring it back up. And that would be a real big problem. So we put it in before we put the epidural in, because I'm gonna tell you something. Even the best nurse in an emergency situation, it's gonna take them 2 or 3 minutes to get an IV in. And if you have a low blood pressure, we wanna fix it much quicker than that. I'm also going to send you to the toilet and ask you to go pee, because I want your bladder empty, because that's going to give me the biggest window of time before I have to start thinking about bladder control in labor following your epidural insertion. And you're thinking, bladder control, pardon me? Let me tell you, labor and delivery nurses, we love an empty bladder for a few reasons. One of which is that if you have a big old bladder in the way of your baby coming down, it can actually slow down their progress of coming into the pelvis, or it can cause some bladder damage. And then after you have your baby, your uterus, it has a job, and that job is to contract down and control your bleeding. But guess what? If your bladder's in the way, that uterus, it has not enough room to expand and contract, which means you could have increased bleeding following the delivery of your baby. So we like an empty bladder, and let me tell you, if you have an epidural, you can't get up and you can't go pee, so likely you're going to end up with a catheter, which again, we'll talk about later in the video. And then before this epidural business gets started, I want to know, what was your blood pressure and what was baby's heart rate, so we know where we started. So if I don't have a recent blood pressure, I'm going to slap a cuff on and I'm going to grab one. And if I don't have a recent baby's heart rate, I am going to use a Doppler and I'm going to listen for 60 seconds to make sure baby's heart rate is happy and healthy before we get started. And if you're up for skin to skin once baby comes out, and I really hope that you are, and you're wearing a bra, we're going to take care of that schmozzle right here and now, because once the epidural goes in and the tape is all over your back, it becomes a lot trickier to get it off. So we might as well take care of it right now. And then once all of that is done, I am finally ready to get you positioned for your epidural and have the anesthesiologist come in to answer any final questions. And positioning is really, really important. In my opinion, it's one of the most important pieces for the procedure going smoothly, because if you are able to position yourself well, you give the anesthesiologist the most room that they can have to work in between the bones of your spine, because that's the area that they have to go through to find the right place to position the tube to give you the best pain control they have. So let's go over positioning right now, because it's so important. You're going to be facing a wall or a window, whatever scenery your site has provided you with, and your back's going to be to the anesthesiologist, which makes sense because that's the area of the body that they are working on. You're going to slide yourself back on the mattress so that your knees are touching the bed, and then the anesthesiologist is likely going to raise the entire bed up, and we're going to slide something underneath your feet, like a chair or a stool, so that your feet are flat up against it. Then you're going to take a pillow, you're going to put it across your tummy and kind of drape your arms over top of it. Now here's the very important part. You are going to make your back into the shape of a C. Try to think about the back of an angry Halloween cat, or like a shrimp. Think like a shrimp. You're really going to curve that lower back, because that's what's going to separate those bones and give them the most amount of space to work. So really important, focus on that C shape. You're going to take your shoulders, you're going to relax them, you're going to put your chin on your chest, and then you are going to take your upper body and kind of slouch over baby, pushing out that lower back and making yourself into that C shape. That's so important. Here's a part that makes a lot of people nervous. Do I have to hold this position the whole time? And yes, it's true. For a lot of this, the majority of this, you do have to hold this position, which, as you can imagine, if you're contracting while the procedure is going on, it can be really, really hard to hold still and hold this position. So if this happens to you, you're gonna focus in on breathing. We're gonna talk through it. I'm gonna remind you to hold still, keep breathing. You can squeeze my fingers, you can wiggle your toes, but for the most part, really focus on keeping as still as you can so that this procedure can be completed safely and quickly. So first off, the anesthesiologist is going to use a cleaning solution, and they're going to clean off the lower skin of your back. It's going to leave it nice and sterile for the procedure. And I have no idea why this is, but regardless of the cleaning solution, it always seems to come out like sub-zero. It's so cold on the skin, so you have been warned. And then the first needle is the worst needle. It's the freezing needle. They're going to use a small needle, and they're going to inject local anesthetic into the skin. First kind of shallow, and then a little bit deeper. And this one, guys, it sucks. There's no two ways about it. This one, you're going to feel it. It's going to be a stick and a burn. And then after a few seconds, thankfully that feeling goes away, but it's going to leave your skin in the area nice and frozen and numb for the next part of the procedure, which is when they're going to use their specialized needle to go through those bones of the spine to find that epidural space. And when they're doing this, you should no longer be feeling pain or sharpness because the freezing is in the skin, right? You should be feeling pressure, and you're probably going to feel it in the middle of your back. But if during the procedure you are feeling sharp or pain or pressure that is not in the middle, it is left or right, you can let them know with your voice. Remember, you're not moving during the procedure, but let them know with your voice, and then they can use that feeling to help guide them into the right space if they need to. Now, once that needle is where it needs to be, they're going to use that needle to thread a small plastic tube into your epidural space. And it's actually this tube being there that allows us to give you that continuous medication and keep you comfortable through your labor. When they place this tube, you might actually feel a little zing go down your legs. That is totally normal. And then once that tube is in place, they're going to take the needle out of your skin. So bring it in. Once your epidural is done, there is nothing sharp left in your back. So if that is a worry of yours, you can scratch it right off your list. And then once the needle is out, I'm going to come around and tape that epidural tube to your back really, really, really well, because that epidural, it is not budging on my watch. And that whole procedure, that whole epidural procedure should take around 5 minutes or maybe 10 minutes if they're having trouble. It does not take a long time at all. And then right before they connect you to your pump to give you that continuous medication, your anesthesiologist is going to deliver a test dose right into the tube. And this test dose tells them that it is in the right spot and that it is safe to hook up the machine and start the medication. When they give you this test dose, you might feel cold go down your back. That is totally, totally normal. It is just the fluid, which is room temperature, going down around your skin, which is not room temperature. While the anesthesiologist is hooking you up to your pump, chances are I am running around and hooking you up to a few monitors of my own. We talked about blood pressure and watching it, so I'm putting on the blood pressure cuff, and we also talked about baby's heart rate, so I am putting on the 2 monitors on your belly that are going to let me be able to keep my eyes on baby's heart rate as the epidural is starting to take effect. Okay, so the epidural is in. You are pain-free immediately, right? Not so much. So the epidural is going to take around 15 to 20 minutes to really work fully. But the good news here is, as it starts to infuse and work in your body, you're going to sort of feel like your contractions are maybe a little shorter, or maybe a little less intense, or maybe they spaced out a bit. Chances are they haven't, but your perception of the pain is now lessening and lessening until that epidural takes full effect and you are mostly pain-free for the rest of your labor. I gotta come clean about something. I said you would be mostly comfortable, and that is because an epidural does not leave you pain-free. It is gonna take away that sharp pain and that pinching pain, but it's not going to take away the pressure pain. But friends, I promise, pressure pain is actually a really good thing. The first thing it means is that baby's head is coming lower and lower and lower into your pelvis, and that in itself is chef's kiss. But the other thing it means is that you know when you're contracting, because the pressure you're feeling through the epidural, that's actually a contraction. And when you know you're contracting, you are able to push that much more efficiently, and that's going to be incredible for your labor progress. And then a good epidural should also leave you able to move your legs. And when you can move your legs, that means with assistance, you can reposition in bed to positions other than flat on your back. And that alone is incredible because movement for you is motion for baby. We reached that point in the video, the elephant in the room. How are you going to go pee? Because by now you realize you can't get out of bed with the epidural, but the toilet is all the way over there. So how do you empty your bladder? Commonly, we achieve this with a urinary catheter, which is actually a tube that we insert into your bladder and we drain your pee for you. But that's a medical procedure, and altogether now, no medical procedure is without risks. So a urinary catheter, it does have its own set of risks. And if you'd like to know, well, can I get away without the urinary catheter? You may be able to, but chances are you probably can't. I always give my patients the chance to try on a bedpan, but I can tell you this, in my entirety of my career, maybe about 3 or 4 people have actually been able to successfully use that bedpan to empty their bladder. Because when you have an epidural, a lot of times you can't feel the need to go pee, and if you can feel it, chances are you can't fully empty your bladder. Maybe you pee out 5 or 10 mils, but really your bladder, it's holding like 200 mils. So it's never really getting adequately emptied for the labor and delivery process. Now, there is a tube that we put in and leave in. This is called an indwelling catheter. You put it in, you inflate a balloon on the inside of the bladder, and then it can't pull out. And then you continuously are draining that urine as you're making it down into a little bag. But there's also an option for an in and out catheter. And this is where you put a tube into the bladder, it drains the pee out, and then once the bladder is empty, we take it back out. And what you utilize is just going to depend on your site and your provider and what stage of labor that you're in. I can tell you that in and out catheters, they have been shown to have lesser chances of an infection than a catheter that stays in. And infection is one of the big risks when you're talking about putting in a catheter. Another risk associated with catheters is having issues with peeing after that catheter comes out and you have gone home with your little baby. So definitely chat with your provider about the catheter and the risks and the benefits before you make any decisions on that point. But keep in mind that bladder control is very, very important. And that's it. That's what you can expect if you want an epidural. And if you're feeling overwhelmed in this moment, you are probably not alone. I want you to know that there are actually 5 different options available to you for pain control during labor. Go ahead and check them out if you're interested. I'll see you next time. Bye.